Everyone, welcome to our podcast tonight. Our special guest of honor tonight, our long-term patient, Suzanne.
Hi.
Hi, welcome to our podcast.
Thank you.
I'm very excited that you accepted to be with us tonight. And we'll discuss a little bit about your journey in dentistry.
Yes, it's been an interesting journey. It's been a long journey.
It's been a long journey. That started quite early in life. So tell us about it.
Yeah, so I was at a pretty young age. I think, around 20, going through life and had a tooth come out just randomly. And I was shocked. I honestly couldn't believe it because I thought, I'm super healthy. Like, what could I floss, I brush my teeth. Like, why would this happen to me? And come to find out, I was blessed with genetics that I didn't have adult teeth in a few areas of my mouth. So these baby teeth hung on for a few years, a few decades. But then eventually, they made it for a while. But then eventually, I started losing teeth and I started freaking out. So, so I, at the time, went to a dentist and their solution was, let's slap on some bridges to cover up.
Very common.
Where you have no tooth now. So things kind of started from there, but I was pretty young. I was in my early 20s and, or late teens. And so I started at that point, but because of that, and because they put those bridges in my mouth in 3 different locations, unfortunately, it caused many other issues down the line.
And not that bridges last forever. Mm-hmm. They are meant to last probably about 7 to 10 years. Mm-hmm. And I imagine they were replaced once or twice.
Yeah, I did. So I went through that whole process where when I was young, they put the bridges in, and then in my early 30s, had to go through that again. Mm-hmm. So more work in my mouth. And honestly, it got to the point where it was like my normal. I really felt like I was living this life of, these things were in my mouth and I don't feel like they weren't secure. Sometimes a bridge would come out when I was eating. And so I was living in this constant fear and this constant place that I really didn't know if I would ever have a normal life. You don't realize how much it actually affects you until you go through it yourself. And it felt very hopeless. And then I guess luckily, we could say luckily, I started feeling some severe pain.
When we met. I remember you had pain, and then you mentioned that your bridge was cemented a couple of times by a dentist, and then the supporting teeth were not in the greatest shape. So it was always a question, how long those bridges are going to last, and are we actually going to lose more teeth because of this treatment option that was offered to you?
And I have to be honest, I didn't know what a prosthodontic was. I was referred to you, and I thought it was really great that we had the connection. And when I met with you, I immediately felt comfortable. I felt like I was in the right place. And I honestly didn't talk to anyone else after that. I was like, this is my person. This is the person for me. She knows, she understands, and and you came up with a solution for what I had been feeling for, honestly, most of my adult life.
I can go back and remember our first sessions when we were planning. We were understanding first what's going on, and we took a couple of images, CT scan and photography and radiographs, and we took tooth by tooth and we analyzed it. And I remember you needed a couple of bone grafts in some areas where the primary teeth were not present, and an extraction, right? One of those abutments of one of the bridge was lost, unfortunately. So I remember that needed to be planned very well. And also you're a very busy. You're a public figure and person that is always traveling, and we needed to work around your schedule. And it was not easy for you coming out of an extensive dental procedure and going back to your busy life. So how did you make room for this complex treatment in your life?
Yeah, they were honestly, I mean, we were working together. I joke about it, but I genuinely miss you because we were seeing each other every other week for like 2 years. Yeah. But I think what I learned from that process is, number one, I think anyone that is going to tell you that they're going to be able to, have you back in action in 6 weeks, like I had a complex case. Like, we did take this piece by piece, and you were thorough and detailed. So it wasn't a matter of like, okay, how quick can we get this done? But a matter of like, what does recovery time look like? And how can I manage this with my life, still live my life? I love traveling. I am really active. And so still being able to live my life. And I think, we came up with a plan for that. So we took the time that was needed to have the recovery. I'm like living a normal life. And then, have this set block of time that I'm coming back and I'm doing more work. And I think for me, that worked well, and especially, again, I feel like there's a lot of people out there that will promise you the world. And I think the realistic expectation and the patience was the most important. Like, I am a millennial. I'm just like everyone else that wants like instant gratification,
Yeah, that's true.
But also, like, this is not something you want to rush, right? Yeah, I'm not trying to rush what is happening in my mouth. And I feel like I struggled for 37 years with teeth, basically. No, I mean, but most of my adult life. So I will take the 2 years to get it done the right way instead of rushing something where I know we're just going to have to go back in and do more work. That's the last thing on my mind. And I actually really appreciate that about you. I think your one focus that you kept saying to me through all of this is like, I want to keep as much natural tooth as possible.
The integrity of your natural dentition for the longest because you are so young. So implants and grafts can come in at any time, but we want to maintain and build up on your foundation. Natural teeth are very precious. As you can see, you can feel different with an implant rather than a natural tooth. So that was one of the primary goals.
Yeah, but what I'll say is, like, I think that many other dentists, I mean, for example, even the first one that put a bridge in my mouth wasn't saying, oh, I need to keep these other surrounding teeth healthy. They were just taking the quick, easy route of like, let's slap a bridge on there and cover up the problem instead of really taking that whole picture and thinking it through. And I think had I done that and had I had someone in my early 20s that gave me that real feedback and walked me through what the rest of my life looked like, I wouldn't have had this journey, right?
Yeah, so, I agree with you. I agree with you. Planning it right, it's taking more time, but then you understand the reason behind it. And we were looking at so many aspects of this treatment. It was planning, it was phasing it out. We wanted to make sure that we fit in your schedule and also that we accommodate you in every aspect that we could. But the biology is biology. And if you have to wait, you just have to wait. Don't rush it through.
There were times where we had to wait 2 months in between procedures or 6 months, I think, one time
for the grafting.
For it to happen. And I think had we have rushed that, you would put in an implant that would have failed, you know, and I think the average dentist might, I don't know, but situations are different, but I appreciate the fact that you never put me in that position, and
we spoke about this from the early beginnings of our relationship.
The expectations were set that this is going to be a journey. This is going to be a process.
We knew. What other aspects of this treatment would you like to discuss? What was most important for you? What was the easiest part? What was the hardest part? What will be the message out there for, there's so many different things that I know you want to say.
I think for me, I think everyone is fearful going into this. Like there are a lot of questions of, we did a lot. I mean, I feel like we redid my entire mouth out of necessity. And even, I mean, we haven't even talked about the fact that we had veneers that were placed improperly in my mouth. Yeah. So we had to redo even those. And that was, because that would have caused issues down the line. So, so again, those small details that I think that you took to me and I can speak to when I talk to people as well that, you could say that you take a lot of time, but you take a lot of time because you want to get it right. And so there are very small, minute details that I think a lot of people would have missed that I was very confident that you weren't missing. Everything had to be perfect with you. And I appreciate that.
Yeah, and our
I have
team as well, right?
I have the smile to show for it.
You have a wonderful smile. And I'm very happy we were able to do this for you. And also our team, right?
Yeah. No, everyone was so great.
Assistants and technicians. Yeah.
I will never forget. I mean, it's rare that you're at an office and you're the people that you're working with, they're like, petting your forehead as you're getting injected with, it's just like, it's those hard times where it's like, you feel like we had a little family here that helped each other through it.
Yeah.
And for me, I think for most people, there are fears of, am I going to talk the same after I have all this work done? Or am I going to be able to like eat an apple or bite into a carrot or, and I think, so I think those things, I mean, I was already just from coming from a place of fear that my bridge was going to fall out at any time. I think, I've always kind of felt like, hey, if I have to give up biting into an apple, but I have a healthy smile, and a healthy mouth and healthy body because it's all related,
Absolutely.
I'm okay with that, know, but I am happy to report that I do eat apples. I just don't bite into apples, but I eat slices.
It's like a princess. And then preserve everything that has been done.
Yeah. And you think about that because again, I mean, I'm youngish, kind of young.
No, you are very young. Yeah.
And so I want these things to last, the rest of my life. So I'm going to take extra care. I invested in them. You invested in them, your time.
Yeah.
And so I want to take care. So for me, it seems like a very small sacrifice to not be able to bite into an apple for, the return of, what we've accomplished together.
Absolutely.
And having, and being pain-free too. I think, it's easy to forget about the pain that comes. I mean, there is nothing worse than tooth pain. I really stand behind that. And so to finally be pain-free and stress-free for my smile, I think, and it was beautiful. And you made a beautiful smile. I feel like that's icing on the cake. Yeah. I feel like a lot of people don't know that you have that cosmetic side as well.
We are cosmetic dentistry, but we focus on function. We focus on building the foundation, which it's subjective because other patients might need it, other patients might not need it. But we are cosmetic dentistry, and we actually use dental implants, bone grafting. We are doing the best we can for the longest time, so our patients benefit from this reconstruction for a long time.
So what clients would come to you? Like a question for you, because I know I came to you, I was a pretty intense case where I came to you because I had so many things going on that I was referred to you, but the average person, how do they know if they should be contacting you?
Yeah, we have various situations, and it is usually a complex situation that comes to our office, mostly by referral, but right now we actually have patients that are looking for a better option for a more like a comprehensive treatment plan and execution in one area, in one spot, so in one office, because we have have everything in-house that we can do. Of course, younger patients are not always reaching us. It's more like middle age or elderly adults that are either about to lose all their teeth, so that implants come into place, or we are just helping them with bone grafting and replacing some of those previous done restorations. So we always get the patients after general dentistry says, I'm done, I cannot help you anymore, and then they are coming over
but I feel
to
like
our office.
But I
or
feel
in general,
like
prosthodontics, this is our field, so this is our specialty.
Yeah.
So prosthetic dentistry is where we comprehensively repair or rehabilitate what has been already treated one time or second time. So then the third or fourth just comes at our door.
Yeah.
It is in a way very rewarding to see that we can give the life back to our patients. They can eat again. They can experience, they can enjoy. They don't have to worry, the prosthetics that they are wearing, they're not working anymore. So, but it's always wonderful to restore a beautiful smile, all natural dentition. And of course, we do a lot of crowns, a lot of veneers, and cosmetic work as well. So it's one part of our treatment. So let's talk about the intermediate phase, so like the provisional phase, when you literally had worn provisional crowns, different phases of the treatment. In the very beginning, replacing all restorations, and later on, implant restoration. So how did it impact you knowing that you have to wear provisionals for quite a bit of time?
Yeah, I think going back to you having a lab in-house, and having the team here to help, I think it was a peace of mind for me knowing that if you needed to make a new provisional, you could, because they're not super solid, So I was very cautious knowing that I had temporary teeth in my mouth.
So we made long-term provisional.
I felt like a lot of times I was like, these are great. We could just stay with this. We don't have to do anything else. These look amazing. I was really comfortable with them. But even there were times I was so scared about the provisionals. You made me like,
especially when you travel overseas.
I knew I was going to Europe.
And I was a dentist. No, I was a little bit.
You were nervous.
How are we going to handle this?
But you were. The team was so great. You guys even gave me like a little to-go kit in case something happened. But it didn't, and so they were really strong. They really lasted. But it was really great knowing that you had the lab in-house here. I knew
totally
that at any time you could recreate it if something did happen. And then
with the digital technology comes in handy. We have archives for everything that we do. And we can remill it or reprint it.
If I had to wait for you to send something off to a lab every time, like there's no way we would not be able to do that.
I agree.
And I
totally
think
agree.
even for the final teeth that we did, the fact that we were able to tweak things and just go back, the technician being in-house. And he would come over and we would talk together and show him the picture and say,
and
this is what we're looking for. And
analyze it on the big screen and photography and everything. That was very good.
I think
that's our protocol.
And I was able to give my input and you were giving yours and he was giving his. Like, I just think that teamwork really made it so successful to have the end result of the smile that I love and I get compliments on all the time.
And although there were long sessions, you managed to work in between. I remember you were always on the phone, always busy. Responding to your associates, and there was a lot of emails back and forth.
I'm in a fast-paced business. I'm in real estate and I own a brokerage and I have other businesses. So I'm definitely in demand, and I had to be able to respond at all times. I worked the entire time I was here. And I know that you were even really like, hey, do you need a few more minutes before we start? And so
try to accommodate, because I know everybody busy life. It cannot stop by going to the dentist, especially when you have a lot of work that needs to be done.
And there is downtime when we're here. So I think you made it really easy for me to still be able to run my business, but still accomplish my goals and move towards, being done with this. So
I'm glad I was able to.
Yeah.
Yeah. Why not? Of course.
Yeah, there was a time where like people would joke because I'm like, oh, sorry, I'm at the dentist. I'll call you later.
Again?
And they're like, you're at the dentist again. You said this 2 weeks ago. But again, it was a journey. You have to have patience in order to get the results that you want. And
Totally.
I mean, I'm sad, but not sad to say that I haven't been here since because it's been like, I think 2022 we finished.
Yeah, it's been a little over a year.
Yeah. I mean, I came for cleanings, but I haven't been here since because everything's going really well, So we put in that time initially to know that long term, now.
Yeah, that's the idea. Longevity. We really want to make sure that our patients don't have to return every now and then for a little repair. But thank you very much for taking good care of everything we did. Yeah. So it's pretty much, we follow kind of the same protocol for any patient, either younger, middle age, or older. We want to assure that they understand the treatment, that there is a commitment, there is a time frame that we really they have to follow instructions, and you did it very well. And then at the end, when the journey's reached its end point, we want to make sure that just a little bit of maintenance time that we require twice a year, and that's just a quick follow-up because things usually run pretty smooth.
Yeah. And I think the biggest takeaway, and if I could offer any advice to anyone, going through this process, and I would say like a difficult process, I would say it's really important to work with, because I've been around the block with dentists. There's dentists in the family, there's friends, and it's so important that you're consulting with someone that knows their stuff and that you can really trust. And I think that changed everything for me because you are a one-stop shop, I think that's the biggest difference is like, there is nothing that you can't do. And you bring in other people, you have a team
yes, we have a
to
team.
help, of course. But I think you can identify things that the average dentist can't. And so I think for me, I will always refer people to you because I can trust that you are going to see the true picture for what it is. I feel like a cosmetic dentist, that if that's all they do, they see cosmetics, I feel like each dentist kind of has their specialty, but with you,
Absolutely.
you're so well-rounded with everything that you see the total picture. But no, that's why it's you. I trusted that you were going to guide me in the right direction, and it worked. It worked out.
I was trying to put all the dots together, your previous experience, the existing situation, and the future planning that will best fit, and of course to last for the longest possible. What our specialty as a prosthodontist, I can say that is how we are trained. We have a couple of years of additional training, and we have to look at the biggest picture, the large picture. And with the end result in mind, we start building back to where the start point is, and we phase it out. And of course, it is a commitment from both. It's a win-win if we get to where we wanted to be at the end. And I think, it's just wonderful.
Yeah.
Well, thank you.
No, thank you.
It's been a great pleasure, and thanks for sharing your journey with everyone listening.
Of course.
And then it's always going to be my personal satisfaction to have our patients happy and reaching their goals. Of course.
Yeah.
It's a mutual satisfaction. Thank you.
Thank you.
Thank you. Thanks for watching, and see you next time.